We had discussed left ventricular assessment by echocardiogram, that is M-mode echocardiogram, recently. Now we will demonstrate a case of left ventricular dysfunction as seen on M-mode echocardiogram. What are the findings in left ventricular M-mode echocardiogram in left ventricular systolic dysfunction? This is an M-mode echocardiogram in left ventricular systolic dysfunction. You can see the cut here, cursor can be seen. Left atrial enlargement is seen in the 2D picture, secondary to left ventricular systolic dysfunction. RVOT, right ventricular outflow tract region, is also dilated. Probably there is associated pulmonary hypertension also. But in this view, we will not be able to comment much on the right ventricle. This is the right ventricular free wall. This is the interventricular septal motion. We can see that there is hardly any contraction, very feeble contractions of the interventricular septum. Similarly, contraction of the posterior wall is also very low. Actually, this is from a case of cardiomyopathy secondary to cardiotoxicity of adriamycin, doxorubicin cardiotoxicity, severe left ventricular dysfunction. And this is the opening of the mitral valve. D point, E point, A wave, F. This is the EF slope. This is the closure line. C is the closure point. An additional finding is that in addition to E and A, early diastolic E and atrial systolic A, there is an extra wave. This wave is known as B hump. B hump is noted when there is elevated left ventricular end diastolic pressure. Anterior mitral leaflet and posterior mitral leaflet have been marked here. Another important finding which is measured on M-mode is the EPSS or E-point septal separation. Normally, when the mitral valve opens, anterior mitral leaflet will almost reach the septum because it will be wide open. Here the opening movements are lesser because of low cardiac output state. And this measurement is known as EPSS. There is a large distance between the septum and anterior mitral leaflet. It is measured here, nearly 1 centimeter. Normally it is less than half a centimeter. So these are the features you are looking for in M-mode in left ventricular dysfunction. Then you can measure the left ventricular function by measurements like internal diameter, systolic and diastolic. Then you calculate the ejection fraction. That has not been shown in this picture. It was discussed earlier.